Good afternoon, everybody. Rob DiVito here at Arizona Center for Laser Dentistry, and we're going to show you the basics of what a laser filling is and how fast it can actually go. We have our patient here, Kobe. Kobe, do I have your permission to go ahead and do a laser filling on you and film it?
Yes.
Thank you very much. If I come over here and I show you, we have a cavity on a particular tooth in the back, and we're actually going to use the laser, no shot, no drill, to be able to take that out and put a nice tooth-colored filling in. But before we do that, let's go through what the laser looks like and sounds like so everybody's on the same page, especially for the patient. So if I show you here, you have your laser glasses on, which is fantastic. I'm going to show you that the laser is literally a beam of light. And what do I mean by that? If you look on my glove, it is a green dot. And if I slap my glove, notice that it doesn't poke my glove. That's just water. Now, if that was a drill, that would frickin' hurt, and I would not like that as much as you would. And the laser, when it works, there's a lot of water that comes out with air, and it sounds like a popcorn popper or a helicopter. So just to show you what it sounds like, it's going to sound like this. Later on, you can tell me what it really sounds like. How's that sound? Yeah. All right. What I'll do is I'll start out slow, and then I'll stop and ask you how you're doing. If you're sensitive at any point, don't be afraid. Just raise your left hand, not your right, so that you don't bump me. And we'll change the settings on the computer. Okay? All right. Awesome. Let's lean you back here, and we'll get it going. I'm going to have Brittany assist with the water, so that way you don't drown. I do use a lot of water, and you want me to use a lot of water. That way we don't burn things. Yes, it is still a laser. Is that a comfortable position for you right there? Yes, fine. Thank you. All right. There we go. Let me turn my light on. I'll have you open. Thank you, sir. And there it is. I will start slow, and then I'll stop and ask you how you're doing. And then for our viewers at home, I will also pause just to show them an inside shot of what things look like in the mouth. All right, here we go. Suction, please, Brittany. So here we are with the water and a tapping. Perfect. This is where I'll have you go ahead and close and open, and where I'll stop and I'll say, how's the sensitivity?
Didn't feel anything.
Do you feel the tapping?
Mm-hmm.
Okay, so I'm not a liar. That's a good news. All right, I'll keep going. There we go. If I'm being too rough, just let me know. You won't hurt my feelings. Perfect. Doing okay? Mm-hmm. Awesome. And go ahead and close and open. That way you don't drown. Brittany, if I could please have the intraoral camera, and I'm going to show the viewers kind of what we've done so far and how fast it's actually worked. If we pan over to the actual computer, we'll take a look, and we'll actually see, if I use the camera on the inside of the mouth, going towards the back, that area where the cavity once was is getting smaller and smaller and almost completely gone. So we will use the laser just a little bit more to get that last speck, and then we'll put a nice tooth-colored filling in, check your bite, and you're done. So I'll turn that off for now, and I'll go back in with the laser real fast. Turning the light back over. Thank you. Are you sure I'm not being too rough on you?
No, you're fine.
All right. I know it sounds weird, but it is the most conservative way to get rid of a cavity and place a filling. Perfect. Go ahead and close and open. I'm going to use a little bit of air to take a look. Any sensitivity to the air there?
Nope.
Awesome. So now what we're going to do is we're going to put a filling in. And what I'm going to do is I'm going to place a piece of cotton on the side of your cheek because we don't want to get any moisture in that area. And then I normally tell my patients it's a shampoo, a conditioner, and a tooth color, just to kind of make it fun, but nonetheless tell you what's going on. I'm going to blow some air in that area. Perfect. And Brittany, can I have the shampoo, please? Thank you. We'll place the shampoo on, and we'll leave it there for about 10 seconds or so. Thank you, Brittany. I'm going to go ahead and wash that off, air and water. Perfect. Don't close. Now we're going to go ahead and put the conditioner on. The conditioner is actually what makes the tooth-colored filling stick. We don't use any metal in the office, which I think is a wonderful, wonderful thing. Yep. We use an amber light so the material doesn't set up too fast before we have time to work with it. Perfect. Thank you, sir. I'm going to blow a little bit of air on here. Wonderful. And then I'm going to use a super special light. Don't everybody look. No, I'm just kidding. So that way things set up now rather than in about 15 hours. And then we're going to go ahead and place the tooth-colored filling in. Yes, please. There you go. I'm going to place the filling. One moment. We're going to make sure that everything looks flush and solid. Now you should feel me a little on your tooth here, but hopefully I'm not being too mean. And then we'll use the light, please. Thank you. And you now have a tooth-colored filling. If we switch back to the video, please, Brittany, we'll go ahead and show everybody at home how fast and how hopefully simple and easy that was to remove a cavity and place a tooth-colored filling. As we go towards the back, there's no digital deceit here. It looks like a beautiful tooth-colored filling, natural tooth color as well. And hopefully the patient enjoyed not having a shot or getting numb during the procedure. How are you going?
Doing good.
Was there any sensitivity?
No.
No? Surprised how fast it took?
Yeah.
Awesome. Thanks for letting us film this, and I really appreciate it. Arizona Center for Laser Dentistry.